Okay, this healthcare situation is driving me crazy. I can't stand it anymore, just sitting on the couch watching you people in Washington discuss this situation in the way that you are, when both the problem and the solution seem, from where I'm sitting, pretty simple, okay? So let's start from the beginning. Mr. President, you said a long time ago that the major problem, the major issue with regard to this healthcare crisis was costs, and that we couldn't solve our economy until we dealt with the healthcare cost. That was the big thing, right? Okay, I agree with you. I agree with you. The second thing, though, that you said was that coverage was not nearly extensive enough. That is, not enough people had coverage. And I'll go with you on that one, too. I too, think that everybody ought to be able to have health care coverage. But you got a big problem in trying to achieve it the way that you're trying to achieve it. Let me try to show you what I'm talking about. Let's just pretend that this blob is the healthcare industry, okay? It represents the costs, okay? And somehow that has to be sustained, right? That has to be paid for. So what we have is we have a support structure underneath it to pay for it. And that support structure is, generally speaking, cut in half between insurance companies and government. Just about half and half. Now, there's another piece of it that's paid by people directly, but just for the sake of argument, let's just look at these two major parts of how we pay for that blob of cost that is healthcare in our country. Now, the problem is, as you've identified, and everybody can see, that the costs keep rising. Okay? So that blob gets bigger. And when that blob gets bigger, then this support structure has to get bigger too, right? So it has to get bigger as well. Now, how does that get bigger? Well, it gets bigger in a couple of ways. Insurance companies, what they do is they raise their premiums. That's one way they do it. Okay? Or they reduce their coverage, so they just don't cover as many things as they used to, or they kick people out. They just take their coverage away, right? And you've talked about that many times. I agree with that. But let's look at what the government does. Well, what does the government do to make this support system bigger in order to handle the increasing costs? Well, they don't raise premiums, of course not. They raise taxes, right? Raise taxes. But that's not all they do. That's not all they do. Another thing that the government does is they reduce payments to doctors and hospitals, right? You just say, I'm sorry, we're not going to pay you as much as what you say it costs, don't you? To try to deal with this increasing cost that you've got going on. But the other thing you do, and governments do all the time when they're in charge of supporting this thing, is they ration care. Now, if you take a time to look at that, what you'll see is that both the insurance companies and the government are doing the same thing. You're both doing the same thing to try to make up for this increasing costs that you've got going on. And no matter what you do, you're still going to be in the same situation over and over again. And this is the reason. Because right now, what you've got going on in the system is pervasive, dynamic, upward pressure on costs. Pervasive means it's all through the system, okay? Dynamic means that it's active, it's alive, it's people, because the system is made up of people, and they're all making choices, they're making decisions based on their human nature that is raising the costs. So our healthcare system is all these people, but the decisions that they're making are all these upward arrows. They're making the costs go up. And the only way you're ever going to be able to get control of this situation is if you turn those arrows around. If you create pervasive, dynamic, downward pressure. Change the system. Now, How are these people creating that upward pressure? Well, there's a few different ways. One is the high-tech medical industry. Now, we're able to do things for people today that we couldn't dream of doing 20 or 30 years ago. And that has an increased cost with it. But I don't think we want to change that because we like being able to do things for people today that we couldn't 20 or 30 years ago. The second thing, though, that choice that people are making has to do with the malpractice insurance that doctors are having to spend money on, and then therefore having to raise their rates because of the malpractice insurance. And they're also having to do increased testing and a lot of other procedures in order to cover their own backside so they don't get sued. Okay? That's another thing that's going on here in the system that's causing that upward pressure on costs. A third item is fraud. There are people in the system making choices all the time to defraud everybody else. That too is causing the cost to go up. But the most important one, the biggest and most important element in this pervasive, dynamic, upward pressure on costs is the third-party payer. The third-party payer. There is not a single other thing in life that people do where they don't have to ask, how much does it cost?